My name is Ryan Michael. I'm 16. I have muscular dystrophy. I've been taking Newsy-Bat for 5 years now.
I am Susan. I am Ryan Michael's mom.
I like hanging out with my friends. I'm a manager of the basketball team. And my favorite subject is math class. My friends describe me as kind, smart, funny, a leader, and cool.
Ryan Michael was diagnosed at the age of 8. My initial reaction was, what is this disease? I've never heard of it before. But I didn't know there are different types of muscular dystrophy until the doctor told me it was Duchenne's. Some of my initial fears and concerns was how long was he going to continue walking? What accommodations would I need to make him at home? How was I going to transport him to and from school or just anything daily life? Would he be able to have somewhat of a normal life at all? How would his friends react to his disease? Everything I read was so negative. And then I started researching some more things and more topics and ideas about Duchenne's.
My mom told me your muscles work differently than others.
What do you think is really hard to do?
Walking, getting up off the ground, playing sports. Can't get tackled. I like to play football, but I can't play. Yes, I'm really proud of my grades. I'm a B student and an A student. I started as a football manager in junior high. I did that for 2 years. Then when I got into high school, I wanted to be a basketball manager. As the manager, I'm responsible to give them water, fill the water bottles up, and help to support the team. And I pumped them up.
And you kept bugging me to reach out to the coach.
To reach out to the coach.
And what did I tell you?
Go ask him yourself.
I was trying to get him to advocate for himself because it's something you really want to do. And what did the coach ask you?
Use my chair and walk. I told him yes, I can do all that.
I came across Duvyzat. So I'm like, this looks really interesting. It fits his diagnosis. It doesn't have like a certain exon requirement. So I sent it to his doctor and she said, that's possible. All the little research I did on it, it looked really positive. It's a non-steroid medication. I like Duvyzat because there's potential that it can be used with other therapies.
She pours it into a shot.
Hands it to you.
Hands it to me, then I squirt it in my mouth. I take it with breakfast and taking it after dinner.
I did notice some side effects. He had low platelet count. He did experience some diarrhea on the side just in the very beginning of it. There is a really great nurse that helps him do the blood draw. It's super easy because it's just at a quick in and out location. And I don't really have to schedule anything. I can just walk in. I want to be able to preserve the muscle in him so he's able to continue being more independent in his life and keep doing the things that he likes to do, just to be more independent. I'm hoping, the graduation's in 2.5 years. He'll walk the stage for graduation. That's my goal for him overall. And then college, starts his own business, whatever it may be. I'm letting him lead his life.
I will really want to go to Eagle Scout. Work hard, get more badges.
First, you gotta work on your Eagle project, which is a big one for him that he wants to do, and I was real impressed with what he chose to do. So, which is the local pool that we have, and it doesn't have any handicap accessibilities to get into it, and he wants to put in like a water lift chair for those with special needs to get in and out of it. So yeah, I would definitely encourage other families to seek out other organizations that are part of the Duchenne community. Being able to support each other, there's always someone that can, kind of help guide you to that situation. And then for Duvizat, I would encourage families to look online and talk to your doctor about Duvizat, see if it's something that would be beneficial for your family.
Talk to your doctor about it, do some research, and see if you like it. It did work for me. It makes me feel happy because I'm still walking.
I'm very happy he's on it also. Just being able to see some of the changes, I was like, wow, he can do this. He's so great. You're amazing.
Indication and important safety information. What is Duvizat? Duvizat is a prescription medicine that is used for the treatment of Duchenne muscular dystrophy, DMD, in people 6 years of age and older. It is not known if Duvizat is safe and effective in children under 6 years of age. Important safety information. What is the most important information I should know about Duvizat? Low platelet counts in your blood, thrombocytopenia. Platelets are important for blood clotting, and a decrease in their numbers can lead to an increased risk of bleeding or bruising. Your healthcare provider will check your blood count before you start Duvizat and regularly during treatment for any signs of thrombocytopenia. Call your healthcare provider right away if you notice any unusual bleeding or small red or purple spots on the skin called petechia. Your healthcare provider may change your dose of Duvizat if your blood platelet counts continue to be low, or may stop your treatment with Duvizat. Increased levels of fat, triglycerides in your blood. You may not have any symptoms, so your healthcare provider will do blood tests before you start Duvizat and regularly during treatment to check your triglyceride levels. Your healthcare provider may change your dose of Duvizat if your triglyceride levels continue to be high, or may stop your treatment with Duvizat. Frequent watery loose stools, diarrhea, and vomiting. Duvizat can cause vomiting and moderate to severe diarrhea. If diarrhea occurs, you should keep track of the frequency and severity of your diarrhea symptoms, drink plenty of fluids, and contact your healthcare provider. Your healthcare provider may change your dose of Duvizat if the diarrhea cannot be managed or does not go away. Your healthcare provider may also stop your treatment with Duvizat. Before taking Duvizat, tell your healthcare provider about all of your medical conditions, including if you have any heart problems or if you take any medicines that could increase your chance for irregular heart rhythms, have any bleeding problems. Tell your healthcare provider about all of the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking Duvizat with certain other medicines may affect each other. Taking Duvizat with other medicines can cause serious side effects. Do not start or stop other medicines without talking to your healthcare provider. Duvizat can cause serious side effects, including: see what is the most important information I should know about Duvizat. Changes in the electrical activity of your heart, called QT prolongation. QT prolongation can increase the risk of developing a type of irregular heart rhythm known as torsade du poing. Call your healthcare provider right away if you feel faint, have an irregular heartbeat, feel dizzy, or lose consciousness. The most common side effects of Duvizat include diarrhea, nausea, vomiting, stomach pain, low platelet counts in the blood, increased fat level in the blood, and fever. These are not all of the possible side effects of Duvizat. For more information, ask your healthcare provider or pharmacist. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see full prescribing information and medication guide. Talk to your healthcare provider if you think Duvizat might be right for you or your loved one.